some question. You take a history in 6 minutes, and the examiner ask you some question in 3 minutes. Okay? So anyone need to start?
Okay, doctor.
Okay, so good morning or good afternoon. You can start.
Okay. Hello, my name is Dr. Ahmed Mohab, one of surgical candidate here. Can I confirm your name and age, please?
I am Richard. I am 65 years old.
Nice to meet you, Mr. Richard. Can you tell me what seems to be the problem today, please?
Usually, I go to walking around my house for about 2 kilo, maybe walking about 1 hour or something like that. So in the last week, I found that after half the way or after 1 kilo, I found severe pain in my left leg.
Sorry to hear that. Okay. Can you tell me, please, it is happening suddenly or gradually?
No, it is suddenly I have pain. It is cramping in nature in left leg.
Okay. Can you tell me in which site in the leg?
It is
Exactly.
below knee. Below knee. It is in the
Below
calf
knee.
muscle.
Okay.
Yes, some
Yeah.
cramping like or something like that.
Yeah. Okay. Is this being moved to any other site or other
No, it
place?
is not related to other place. It is just localized to my left leg below the knee.
Okay. Can you tell me, please, it's anything can make it increase or anything make it decreasing?
It is decreased. I just stay in my place for 5 minutes, so the pain is decreased. If I insisted to walk, the pain increase and I need to stop again.
No, sorry to hear that. Okay. Can you score your pain, please, from 1 to 10? 1 is minimum and 10 is maximum.
It's about 5.
Oh, okay. Now I wanted to ask you, is this pain increasing with going upstairs?
Yes.
Okay. Is this pain, do you have any other weakness or numbness in your leg?
What you mean by numbness mean loss of sensation? No.
Yes, yes. Okay. Do you have a feeling like coldness in your legs?
Yes, my left leg is more cold than my right leg.
Oh, sorry to hear that. Is there any breach in your skin of your leg or something, or any
What
wound?
you mean by breach? You mean wound?
Like a wound, yes, or injury, yes.
No, no wound.
Okay. Do you have any back pain?
No back pain.
Okay. Do you have any problem with urination or passing stool?
Okay, before you jump to the urine, can you ask about the other skin manifestation?
Okay. About the color of skin?
Yeah, the color of skin is little pale
Yeah. Okay.
in comparison to other leg.
Yes. Okay. I just wanted to complete my history. So I wanted to ask you, is the distance that after it you feel that severe pain that need to stop, please?
It is about 1 kilo. I walk about maybe
1 kg.
10
Okay.
minutes. Yes.
Yeah. Is it pain occur also during rest?
No.
Okay. I wanted to ask you now about your past medical history. Do you
Yes.
have any chronic disease?
Like what?
Like hypertension, like diabetes, like
I have
cardiac disease.
hypertension, no diabetes. I have hypertension and high cholesterol.
Okay, you are taking a medication for it?
Yes, for hypertension, I take something called the Brondopil or Coversil, 5 milligram. For
Yeah.
cholesterol, I don't take it regularly. It is Simvastatin, 5 milligram, but I don't take it regularly.
Oh, thank you for this information. Did you undergo any surgery before?
No.
Okay. Do you have any allergies
To what?
to medications or food?
I allergic to seafood.
Okay. Do you have any other family member have the same issue or something?
No, but my father died from heart attack.
Oh, sorry for your loss. I wanted to ask you personal questions now, if you let me, please. Do you smoke?
Yes, I smoke about 20 cigarettes per day for the last maybe 30 years.
Yeah, okay. And do you drink alcohol?
Yes, I drink 1 can of alcoholic beer every day with dinner.
Okay. What do you do for living, please?
No, I am retired. I was a teacher and I'm retired now.
Okay. Can you tell me, I want to ask some general question regarding your health condition, okay?
Can
Can you tell me if you have any tremors in your hands?
no,
Do you have any irregular heartbeats?
no,
Do you have any chest pain, cough?
no chest pain, no cough.
Okay. Do you have any muscle or joint pain apart from this leg, of course?
No.
Okay. I want to now to summarize what we have been through now, this
Okay.
conversation. So you have now since 1 week left leg pain and the calf muscle cramp pain. It's severe that makes you stop from walking, and it is improved after stopping walking and increase when you start to walk again. You have this pain is scoring about 5 on pain score, and you are diabetic. You are hypertensive and taking medication for hypertension, and you have. And you don't have any other chronic disease. You are a smoker and you are drinking alcohol. You didn't undergo any surgery before. Did you? You don't have any numbness in your legs or weakness. It's just this pain. And you don't have any wrist pain also. My main okay. So I now finish taking history with you. I will get back to my consultant and I communicate with you shortly regarding your case. Okay.
Okay. Thank you, doctor. So
Thank
what's your
you.
diagnosis?
My main provisional diagnosis it's atherosclerotic lower limb ischemia.
Which limb?
That left leg ischemia
Left leg ischemia. Okay. All
causing
right. So
claudication.
how to manage this patient?
Okay. First, I will control hypertension for the patient, and I control the dyslipidemia if it's occur, and I will modify the medication for the patient, and I will advise the patient with exercise and modification of lifestyle, and maybe I will give also antiplatelets for the patient if needed.
Okay. What other investigation you need to do?
I should do duplex ultrasono duplex on his left leg arteries, and also I will do CT angiography and MRA
Okay.
also.
No. You did the three just one by one. You did duplex
Okay.
and
Yes. CT
this is
angiography.
okay. So this is the angio, not necessarily. This is the angio. What is your opinion?
Yes. So there is there is swelling defect in the in this leg. It is left leg.
Which
Okay.
artery?
Popliteal artery.
Okay, the end of femoral and the beginning of popliteal. So how to manage this case now?
Okay, so manage of this case, it will be by doing bypass graft.
The bypass graft is done in maybe 5 years ago or 10 years ago. Now, what is the cause of obstruction here?
Endovascular treatment.
No, just
So
relax, doctor, relax. What is the cause
okay,
of this
okay.
occlusion?
It's ischemia.
No. What is makes this occlusion? Ischemia is the diagnosis. What here?
Yes, maybe yes, it is a filling defect. So it is a thrombus.
Thrombus. So you need to remove the thrombus first or not?
Yes, of course. Yes.
Okay, so embolectomy first. After that, if it
I
is
will
still
do.
narrow, what you do?
Yeah, I will do endovascular
Doctor,
endovascular
relax.
management.
You need to be good observer. So
Okay.
you make embolectomy or thrombectomy, you inject the heparin. After that, what you see besides the picture?
Stent. I
What
will
is
put
it for?
stent.
No,
Stent.
this is not a stent. It is a balloon dilatation for narrowing. After that, if they're not improved, we put a stent. So you need to remove the thrombus first.
Yes.
Okay?
Yes, of
All
course.
right.
Yes.
Okay, finish. So I just comment on you. First, I just back to see what you miss. You start by introduce yourself and everything. All this is okay. It is important in ischemic patient to ask about the skin manifestation. And the first skin manifestation is loss of hair. Skin change, you mentioned wound or ulcer. You need to ask about infection between toes, sometimes the fungus infection. Of course, you need to compare. You ask about coldness. You don't ask about sensation, but you ask about cold color, but you don't ask about sensation. So loss of hair sensation is very important to ask about this in comparison to other
Okay.
link.
Okay.
No chest pain. It is sometimes you need to ask about erectile dysfunction because sometimes the patient have something called the thrombus in the bifurcation of aorta, what we call it Lurie syndrome. It is not important to know the name, and this can cause cut the blood supply to the nervi argenti or parasympathetic and cause erectile dysfunction. When I say you ask about hypertension, I tell you the treatment, and you ask about cholesterol, I tell you I don't take the treatment. So what is the logic answer after that? If I say I have hypertension, I take Coversil or Borentopil, but
Mm.
I don't continuous or don't take the medication of the high cholesterol. So what is supposed to
So
ask the patient?
yes, I should repeat the cholesterol profile for the patient and start to give medication if it's high.
No.
And
You
there
need
was
to be logic, doctor. Relax. You need to be more logic. If the patient say I stop medication, you need to ask him why you stop medication. Okay. So why?
maybe
Maybe dislike, maybe have side effect, something like that. And
Mm.
sometimes the patient, if have statins, they can have high liver function or
liver
something.
failure, liver function. Mm.
Not failure. Okay.
Yes, liver function. Yes,
But you ask
yes,
about other system, you ask
yeah.
about aspirin, all this, you ask about other system is okay. So it is just chronic pain. You ask about investigation. When you describe the investigation, don't say a list again like yesterday. I just start by handheld Doppler, Doplex. I can do angio. Okay, but we don't give the patient a list of investigation. We start step by step. It is like if patient have obstructive jaundice, I start by ultrasound, I do ERCP, or later I do MRCP, but I don't do all together. Okay, so it is important to minimize your talking about investigation or treatment. Okay.
But
Can you
so
explain why this patient have no severe sign of ischemia? If you see this picture, why?
no severe sign of ischemia.
Yes, like wrist pain and short distance communication from the picture. Why he is not bad? You see the cut. You see the end here. It is good or
Ah,
bad. This
it is
patient is
good. Yeah.
lucky.
Yes. Yes.
It is have good
Yeah. Yeah.
collateral. I don't know from where it come because the femoral artery here is like in the
Uh-huh.
artery, but
So
he is
because of
lucky.
collateral.
He have a
Mm-hmm.
good collateral, so this is a lucky patient, by the way.
Mm.
Okay.
So, doctor, yeah, I can pass in this station.
You will pass. We don't fail anyone in the exam. You have mark. We don't have pass at the failing exam. We have mark like out of 20. We give you, for example, 16, 17, something like that. You can pass, no problem.
Okay.
Okay.
Thank
By
you,
the
doctor.
way, in exam, you can have bad performance in many station. Is not affect your score because it is a summation of the numbers.
So you
Okay,
give
so
me
this
16 here, doctor.
16. Okay.
Okay. But I wanted to
All
ask one
right.
question,
By
please.
by the
Please.
way, you tell sorry
Yeah.
3 times. You can ask, no problem. You can ask.
No, no. Okay, complete, doctor, please, because this I
No.
wanted to
You
hear
can
from you.
ask. You can
Okay.
ask.
Just
Ask.
you told me don't list the investigations.
Yes, because
But
you mentioned that I do duplex CT angio and MRI. So it is unlogic to write a list of investigation. You can write a list of lab investigation, but don't.
I want I just wanted to show the examiner that I know all these investigations.
This is unprofessional, doctor.
Mm. Okay.
Okay, it is important to know that if you so clever, it is not good. If you have a lot of talking, it's not good.
Okay,
Okay,
doctor.
all right.
About Suri. About Suri.
No problems. You say 3 times is okay. Some students say 10 times per 10 times per station.
Okay, thank you, doctor.
Okay.
Thank you
All
so
right.
much.
Thank you. Any question from others about this station? Okay. Second scenario is about 65 years old, attend an outpatient clinic, complain from altered bowel habit. Altered bowel habit means a constipation and diarrhea. So anyone is interested to start?
I can take it, doctor.
Okay, so you can start, Dr. Lamia. Okay, so you can start.
Good afternoon.
Good afternoon. Yes.
I'm Dr. Damian, who's a surgical doctor. Could I please confirm your name and age?
I am Charles. I'm 65 years old.
Nice to meet you, Charles. I'm going to ask you a few questions about your health, and I'll be taking some notes. Is that okay with you?
Yes, can.
How I can help you today?
No, actually, I go to my GP and transfer him here because I have constipation and diarrhea. So I usually go to washroom maybe once per day. But in the last 2 months, I go to sometimes once every 2 days. And sometimes in some weeks, I go to 5 to 6 times per day. So I have like alternation between diarrhea and constipation.
I'm really sorry to hear that. That must be very difficult for you. When did this start exactly?
Say again, it is 2 months ago.
Is it associated with any abdominal pain?
No abdominal pain.
Did your stool contain any blood?
Yes, the color of the stool is dark. It is not fresh blood, but it is dark color.
Okay. Do you have any mucus in your stool?
No.
Any weight loss or loss of appetite?
Yes, I lost 5 kilos in the last months. Appetite is okay.
Do you have any fever?
No fever.
Do you experience any accidental leakage of your stool?
You mean uncontrolled?
Yes.
Yes, no.
Do you feel that you are not, after you finish, you still have a desire to go to the loo again? Like you're not completely.
First, it is no. I think you are mean to but I don't understand what you mean by no.
Okay. Do you have
Can you
any?
spell to me? Can you spell to me?
Say it again.
I don't yes. I sometimes I have incomplete evacuation, but I don't understand when you what you mean by loo.
I mean restroom.
Restroom. Okay. Can you spell loo for me, please? What is this?
L-O-O.
All double. Okay. All right. Thank you. Okay. Go on.
Do you have any change in your eye color or redness?
No.
Joint pain?
No.
Mouth ulcer?
No.
Any headache?
No.
Chest pain?
No.
Feel aware of your heartbeat?
No.
Any change in your urine?
You mean the urine color or frequency or pain with urination? No. So if you ask about urine, you ask about pain, you ask about increased frequency, you ask about color? No.
Okay. Is there any vomiting?
Say again?
Vomiting?
No.
Do you have any vomiting? Okay. No. Do you visit your GP frequently for any medical condition like high blood pressure?
No blood pressure, no high blood pressure, no diabetes.
High cholesterol level?
No.
Have you ever been admitted to the hospital before?
No.
Do you have any surgery in the past?
No,
Do you take any regular medication?
no.
Do you have any allergy from any medication or drug? Any medication or food? So,
I'm allergic to seafood.
okay. Is there anyone in your family being diagnosed with any medical condition like colon cancer?
My father died from cancer colon 20 years ago.
I'm really sorry for your loss.
Thank
Do
you.
you smoke, Charlie?
Yes, I smoke 20 cigarettes per day for the last 30 years.
Do you drink alcohol?
Yes, I drink 1 can of alcoholic beer every day with dinner.
Okay, thank you, Charles. I will discuss your case with my consultant and came back to you shortly.
Okay. I just to show you the picture, just we show the student. I hope that I found it. Where is the picture? It's not here. Okay. All right. What you miss now? What you miss at the end? I just show. Okay. Okay. What you miss? What you need to tell me now? You can see this picture. I share it again with you.
Yes.
Maybe don't use for that, but you can see this picture. You see these people.
Summarize it.
What is this?
Okay.
What these people do? You can see this picture.
Yes.
It is what these people do?
I'm not sure.
These people who transport the food is called Grab Food or Food Panda. It is a famous company for food. So if you make an order by telephone, through the telephone to any company of it, after he thank you at the end, what he say before he say thank you, doctor, or thank you, Dr. Lamia, what he ask, what he tell you? If you make a food order, like if you know Kentucky Fried Chicken or KFC, when you make an order, he say at the end, thank you. Before thank you, what he make?
He will confirm what did
So
I...
he summarized the order. So you need to summarize,
Yeah.
Dr. Lamia. If you miss-summarized, you lose 1 mark. You can summarize.
Okay, Charles, just to confirm, you complain of constipation and diarrhea that started 2 months ago, and weight loss, and you have a family history. You have a family history include colon cancer.
Colon.
And
Okay.
yes, cancer colon. And
What's your diagnosis?
colon cancer.
Why?
Cancer colon.
Why?
The patient is elderly, his age, and alternation in bowel habits associated with weight loss.
Weight loss. Okay. So when you take a history, you ask about fever. Why you ask about fever? To exclude what?
I ask about it as a, I think, part of a general.
Okay, this is
history.
you have minus mark now. I just tell you. Can you? Okay, so we ask about the fever, not that. I tell you first. So first you ask about bleeding, amount of blood or fresh blood, defecation, alter bowel habit you ask, tenesmus you ask, fecal incontinence you ask, loss of weight you ask, loss of appetite you ask, exclude fever to exclude diverticulitis. So in colonic case, we ask about fever to exclude diverticulitis. In some country, like in India, they ask about fever for gastroenteritis, but in the European country, they're looking for diverticulitis. Okay? You take all the item good, you ask about medical history, family history, drug history, family history, social history. You ask about other system. When you ask about urine, you ask about dysuria, changing color, and increased frequency. If the patient is elderly more and have prostate or something, you need to ask more question. You ask about joint pain. You ask about mouth ulcer, but I don't know why you ask about mouth ulcer.
As a part, I know it's as a part of inflammatory bowel disease.
Part of inflammatory bowel disease. Okay, Ken, no problem. So what other differential diagnosis in your mind Apart from diverticulosis, apart from cancer colon, is some rare disease can occur in elderly, can cause bleeding by rectum, but no loss of weight?
Inflammatory benign polyp.
What else? No, something occur in elderly after age of 70 and cause bleeding by rectum, and it is a benign lesion.
Dysplasia.
Angiodysplasia. Okay, so we can ask. We don't ask you. This is one of the question of exam. We don't ask the patient. So we have something called angiodysplasia. It is like hemangioma occur in the colon or anus in the after age of 70. Of course, it can be hemorrhoid, you can polyp, but this patient is most probably the cancer colon. What is the histopathology or name of cancer colon? Which type of cancer occur in colon?
Adenocarcinoma.
Adenocarcinoma. Okay, all right. So how to stage cancer colon? If you have any stage or you know any stages for cancer colon?
Dox criteria.
Dox criteria. Okay, so what is Deoxy mean or Deoxy D mean? Deoxy D, what is Deoxy D?
I don't know what I know the statement, but I'm not. I don't know the.
Deoxy D is distant metastasis. Deoxy D, you see the screen now? You can see the screen or not?
Yes. Yes.
Okay, Deoxy D is distant metastasis. What is the common site of metastasis for cancer colon?
The upper aorta. I'm not sure.
What you expected? It is easy. If you have cancer colon, it is metastasized to liver. Why? Because of the portal circulation or portal venous drainage. We have also TNM staging. This is Dukes. We have TNM staging. Just to know T2 is invading muscularis propria. T3 is penetrated it. Okay. Is any tumor marker we can use it for cancer colon?
Carcinoembryonic antigen.
Antigen. Okay. Of course, diagnosis confirmed by colonoscope and biopsy. And how to exclude spread or metastasis? How to exclude metastasis in cancer colon by doing
CT scan.
For what?
Abdomen.
Thorax, abdomen, and pelvis. We call it in subcountry tab, CT tab, thorax, abdomen, and pelvis. Okay. All right. Thank you so much. I just need to explain to you. You know that I examined some students and found that most of the students say, if you go to the loo is not common, although it is in slang, but it's not common word used in English now. Okay? You understand me?
Okay.
Okay, like BU or loo, or BU mean bus urine, by the way, and loo, so it is not common used because I think that most of the Middle East doctors say that, but it is not common used nowadays. All right, I just need to explain that who is coming in exam in history is not a layman. It is a person, he usually is high educated, and usually he's a teacher of English, either in British Council or in some high institute or university. So it is highly educated person, not layman. Okay, except this patient with pseudo aneurysm, it is like homeless man. Okay. All right. Thank you, Dr. Lamia. Well done. Of course, you ask about, if you see, you ask about all item in the cancer colon, which is very important to ask: elder bowel habit, painful tenesmus, fecal incontinence, loss of weight, loss of appetite,
Dina.
and don't forget to ask about fever.
Dina.
Okay.
What is it?
Oh, all right. So after that, we speak another topics is this way. Any comment, by the way? Any comment from anyone? Anyone have this station an exam before or have any experience?
I want to ask one question, please, Doctor.
Yeah.
Yeah. If you have two complaints, we must analyze the two complaints or the main complaint only?
We don't give you two complaints. It is important to know the history station in this MRCS exam is not to test you history of these topics. It tests you how to take a history in general. So this is why many of our topic is not related to surgical field. Okay.
Yeah.
But
okay.
Suppose if the patient have jaundice, it is difficult to have to complain like what? How it come to complain?
Like any complaint that was associated with pain. So the main complaint, it is something else, but I must analyze the pain also like that.
No,
Yeah,
if the patient
Socrates.
have jaundice and the pain, so you need to ask about pain, you need to ask about jaundice, you need to ask about color of urine, you need to ask about color of stool, you need to ask about itching, because this is very important.
So I will ask about
Okay.
all. Yes, yes. Okay.
Yes. Okay. All right.
Okay.
All right.
Dr.
So,
Can I
yes,
ask about the fecal immunological test in this
what you
station?
mean by immunological test?
Fecal immunological test to see if there is any blood in the
Okay.
stool.
So it is also unprofessional. I tell you, you mean fecal occult blood or what?
Yes.
No, fecal occult blood you can use for screening. This patient is a critical. You need to have colonoscope. You need to take biopsy if you have a lesion. It is not inflammatory bowel disease simply because the inflammatory bowel disease, if this happens, the patient have bleeding rectum for 10 years, 5 years, long time, and it's not affect his health. So if they have the same scenario and for 5 years, so most probably it is ulcerative colitis or inflammatory bowel disease. You can get for Crohn's like fecal calcitrine or captine or something like that. Okay. All right.
Okay.
Yes. Caloprotected. Yes. All right. After that, we have patient, 65 years old man, chronic smoker, complain of vomiting blood. Yesterday, he admitted in the surgical ward. So he has hematemesis, 65 years. Okay. So any volunteer? Anyone? Don't be shy. Again, in
I
exam,
can
you
join
have
you,
two
Doctor.
stations. Okay, you can start. Dr. Peter. Okay. So you can start.
Good morning. My name is Dr. Peter, one of the surgical doctors. Can I confirm your name and age, please?
Yeah, I am Richard. I'm 65 years old.
Nice to meet you, Mr. Richard. How can I help you
Yes.
today?
Yes, yesterday I have vomiting of blood. So I become in panic. I call the ambulance and they bring me to the hospital.
Okay, before we start, do you have any pain right now?
Yes, I have.
Would you like to me prescribe some analgesia?
Yes.
Okay, can you tell me more about the vomiting of blood?
All right. So if you ask the patient this question and the patient say, yes, I have pain. So what suppose you to do?
I'm very sorry to hear that.
No.
And
You ask the
sympathy.
examiner, we need to give him some medication. Sometimes in some station, like catheter stations, the patient say, you know, I need to drink water. So you ask the examiner, can bring water to him. So it is important if you ask any question, if the patient say yes, so you need to answer him. So he say have a pain, so you have no response. So this is also unprofessional. Okay. All right.
Okay.
Okay, so take care from these silly mistakes is the cause of failure for many candidates. Okay, or not failure, just to decrease the mark. Okay, so you can start. I just have vomiting blood. It is painless, no pain at all.
Is this the first time that happened to you?
Yes, first time.
Do you have a severe pain with the vomiting?
No pain at all.
No pain
I
at
just
all.
tell you pain just to see your response, but I have no pain.
Okay, how much is the amount of blood?
It is like half cup, just a small cup, and it is fresh blood, not mixed with food.
Okay.
Or
Do you
mix
have
it with food. Make it mix it with food. Mix it with food. Okay.
Okay. Have you experienced any weight loss recently?
No, before weight loss, this is which organ we're looking for now?
Stomach.
Before stomach. Esophagus. What is the function of esophagus? So you need to ask about the function of esophagus. You need to ask about esophagus first. So what you ask?
Do you have difficulty swallowing?
Yes, I have
food
difficulty
or
to
water?
swallow. Yes, I have difficulty to swallow to solid.
Okay. Do you have any heartburn?
Yes, I have heartburn since the last 5 years.
Do you feel acid on your mouth?
Yes, I feel acid in my mouth.
Okay.
So first, Dr. Peter, you need to be logic first. If I tell you I have difficult to swallow to solid, so the logic answer is where the food is stuck. So it is stuck in lower part of my chest or upper part of my abdomen. This is first. When you ask you have heartburn, I say yes, since 5 years. If I say something for long period, so the second logic question is what? If I say I have hypertension, so what is the next question?
What medication you take for?
All right, okay. So I tell you I have heartburn. I have epigastric pain since 5 years. Okay, so what is the next question?
Do you take medication for your heartburn?
Yes, I went to the doctor 5 years ago. He make the endoscopy. What is the next question?
What were the results?
The result, he say I have reflux esophagitis, and he gave me the medication called proton pump inhibitor omeprazole. I take it for 1 month, and I don't take it now. I just take it for 1 month. I don't like medication. And he also asked me to stop smoking and alcohol and spicy food, and I don't follow his instruction.
Okay. Do you feel any lumps or
No. Before that, you ask about loss of weight. So yes, I lost 5 kilos in the last month.
Okay. Did you notice any lumps in your neck?
You mean right side, left side?
Both sides. Like.
No lump.
Okay. Have you had any fever recently?
No fever.
Do you feel like food come back to your mouth after swallowing?
No. I just have heartburn, acid. I wake up in the evening to have acid taste in my mouth.
Okay.
Other system.
Do you have any chest pain or feel your heart?
No chest pain, no heartbeat.
Do you have any cough?
No cough.
Okay.
Urine is okay. No pain in urination. No increased frequency. No pain in micturition. No diarrhea and constipation.
Do you have any other medical conditions like increased hypertension, increased blood pressure, or diabetes?
I have high blood pressures and I take Pronto-Pill.
Does anyone in your family has any similar condition?
No, but my father died from heart attack.
Do you take any medication? I'm very sorry.
No, if I relax, doctor, if I tell my father died from heart attack, what is your response?
Yes. I'm very sorry to hear that.
Thank you. Go on. Next.
Do you take any medications right now aside from your hypertensive medication?
No.
Do you have any allergies from any medication or food?
I am allergic to seafood.
Have you ever been admitted to the hospital?
No, just last time, 5 years ago, because I did the doctor make endoscopy for me and give me the report.
So you said you're a smoker. Is that correct?
Yes, I chronic smoker. I smoke about 20 cigarettes per day for the last 20 years. The doctor asked me to stop, but it is difficult to stop.
Do you drink alcohol?
Yes, I drink 1 can of alcoholic beer every day with lunch, with dinner.
Okay, do you live alone or with someone?
No, I live with my wife and 2 children.
Okay, and what do you do for a living?
I am retired teacher. I teach English.
Okay, thank you, Mr. Richard. Before we end, can I summarize with you what we have talked?
Okay, can.
Okay, Mr. Richard is a 65-year-old man, came complaining with vomiting of blood yesterday. He was admitted to the surgical ward. He has a 5-year history of heartburn and gastroesophageal reflux disease, to which he was prescribed the proton pump inhibitors, but he neglected the medications. He is experiencing some weight loss and dysphagia towards solid. He doesn't experience any chest pain or coughing of sputum or any fever.
Okay. Thank you, doctor. So what you summarize now, you summarize to the examiner. So it is important. If you summarize for examiner, it is proper. If you summarize to the patient, you just tell, you change the way of speaking. Okay. First, it is very important. We have in the exam, one of the items we do in exam is how to manage time. Manage time is okay for you, and what's something called intelligent, like how to become smart or intelligent. So sometimes the patients say, I have hypertension since 5 years. I have gastritis since 5 years. I have hernia since 5 years. So it is a logic. He went to the GP or the doctor. The doctor described medication or make investigation. Once the patient say, yes, I have reflux, I went to the doctor and he asked for endoscope, the patient stopped. So tell him what is the result of endoscope. If you don't say what is the result of endoscope, he's not volunteer to tell you the result. Okay?
Okay.
So we start by bleeding. Is easy amount of fresh blood mixed with food. After that, it is important to ask about esophagus. So have difficult to swallow? Yes. To solid or fluid? To solid. So what is the level? Can be upper, like nasopharyngeal carcinoma, can be middle in stricture, can be lower in lower esophageal tumor. So this patient, you ask about heartburn and he don't take a medication and is still smoking, still eat spicy food, still drink alcohol. So most probably what happened to him? What's your diagnosis now?
Esophageal carcinoma, Barrett's esophagus.
Oh, esophageal carcinoma. What's the name of this cancer? Like
Barrett's
name of cancer? No. Barrett's esophagus is a metaplasia is another question. Name of cancer like squamous cell carcinoma, melanomas. So the lower esophageal cancer is adenocarcinoma. Cancer stomach, cancer esophagus is very common in pathology station, by the way. So the patient have adenocarcinoma due to Barrett's esophagus. So next question, what is Barrett's esophagus?
Metaplasia of the esophageal lining due to chronic irritation by acid reflux.
Okay, so what you expected the next question? You say Barrett's esophagus is metaplasia is due to irritation. So the next question is supposed to be, what is metaplasia? What is metaplasia definition?
Change in cellular lining type.
From stratified squamous epithelia to become stratified columnar with complex cell. Okay, so this patient have adenocarcinoma of lower esophagus due to Barrett's esophagus due to chronic reflux, don't take a treatment. And this Barrett's esophagus is metaplasia of the lower part of esophagus. And it is due to change from one type, which is stratified squamous epithelia, to become stratified columnar epithelia. Okay, so this patient, if we do surgery, so when we remove this part of the esophagus, if we remove this part, what we put instead? If you remove this part of esophagus, like lower esophagus, you remove about 5 centimeters with safety margin. So what shall we do later? If you remove this part, what happened after that? What you think?
We can make a jejunostomy for feeding.
Jejunostomy is okay, done for feeding is correct answer, but this gap, this is gap, we put the stomach up, we call it stomach up or stomach tube, if it have esophagectomy. If the patient inoperable or difficult to be operated, so we can put a metallic stent or self-expanded metallic stent. You ask about lymph node. So which lymph node you looking for? Right side, left side? Left side. So why left side? Because
Virchow's node.
Virchow's lymph node or Virchow's lymph node, because the thorax duct is in the left side. So usually, if you can ask right, left, no problem, but in particular, in any GIT testicular tumor, you're looking for Virchow or Virchow's lymph node, which is the left side. Okay? So again, you start by bleeding, you ask about dysphagia, difficult to swallow solid and fluid, level of food stuck, loss of weight, loss of appetite. In some patients, because it can be one of differential diagnosis, what other differential diagnosis you think can cause bleeding? Maybe common in your country is?
Esophageal varices.
Varices. So at least you need to ask about, of course, you can ask about hepatitis, you can ask about alcoholic liver cirrhosis in some patients, but this is clear because they have dysphagia, so it is not portal hypertension. Of course, you ask about other system. It is important who ask me at the beginning. We need to ask about other system. Yes, because each item in the history have a mark. So in the past, students forget to ask about systematic review, ask about allergy, medication, family, all this. So it is important. Of course, you ask about investigation, OGD, CT, thorax, abdomen, pelvis. Sometimes in cardiac achalasia, but not in cancer, we have something called the esophageal motility study. If the patient have dysphagia to fluid in young age, we have nowadays something called esophageal motility study or esophageal manometry. Okay. All right. You entered the exam before, Dr. Peter, or this is first time?
First time.
First time. Okay. All right. So you really don't take a time in thinking just to be more faster than that, but it's okay. Any question from your side, Dr. Peter?
Thank you, doctor.
Okay. All right. So it is esophageal. Of course, this is cardiac achalasia. We don't do nowadays barium swallow, but it is just for interest. Okay. Any question?
So how do I score for this, doctor?
Although you don't have fatal mistake, you don't
I was
have
slow.
fatal mistake, but I think the lay examiner is not will be happy with you. I don't like your attitude is not like you look like tired. Sometimes in exam, some students look like tired or unsleepy or something like that. But overall, you don't have fatal mistake, except I prompted you to ask about dysphagia, and you don't pick the point about this patient have endoscope. So what is the result? They have varices, or what he don't take a treatment, all this. But you know that with practice or just to see our videos will be improved much, inshallah. Okay, after that, we have neck swelling. So we have a thyroid.
Oh.
Yes, can you ask what you need to ask? Anyone?
Doctor, if I mention the barium swallow in the exam, it will be fatal mistake?
You are working in which hospital, doctor?
In Damietta.
This is the hospital. Is do barium swallow still do barium swallow?
No, but we don't. You know, we're sending a patient to do outside. You know. And,
No, we don't
Okay.
do barium swallow at all. Barium swallow is historical, like barium enema. These all are historical. We have esophageal motility available. We have for cardiac achalasia in particular, by the way. But don't say something is look strange, because you know the examiner is many generation. So suppose the examiner is the age of 40, 50, so he don't see barium swallow in his life. Okay, it is important to know that who have bad mark in exam is have no bad mistake. It is just his attitude is unexpected by examiner. Like he says something historical or something very old. If you are old age, suppose you are 50 or 60, and in exam say barium swallow, we accept it from you, because this is maybe what you learn in medical school. But if you are young and say I do barium enema for the patient, no one done barium enema for cancer colon nowadays, simply because can do colonoscope and have biopsy. No one do barium swallow nowadays because he can, for achalasia, he can do esophageal manometry. For cancer esophagus, he can do endoscopy and have biopsy. So this is historical. We can use it in exam, we can use it for interest, but not use for MRCS. You know that MRCS is a professional exam, although maybe in some country is not equal even to the master, but it is professional exam. Okay?
Doctor, thank you.
All right. In Dumyat, you have a good journal in surgery. We review it in Malaysia, by the way, the International Journal of Medical something or Surgical something. Okay, so of course, by the way, it is important to know that in each scenario we have more than one version. Just because the students think that we have the same exam and repeat it every day. So for example, here, you can have these versions. You have 22 years old girl presented with outpatient clinic complaint of right neck swelling, or she have toxic manifestation or something like that. Okay. So whatever, we forget the toxic manifestation. So this is young girl, 22 years old, presented with right neck swelling. So anyone is volunteer.
Hi, doctor.
Okay, can. All right, you can start. What's your name?
Paris.
Paris. Okay, you can start, Dr. Paris. Of course, this
Hello.
is, hello, yes. This is female patient, so I give name like Anne Mary, 22 years old. So I am Anne Mary. Okay, you can start.
Yes. Nice to meet you, Miss Mary.
Yes.
Yes, I'm Paris, one of surgical doctor. I'm going to ask you some questions about your conditions. Is that okay with you?
Yes, can.
What seems to be problem?
Yeah, actually, I prepared to my wedding after 2 months. So when I tried address, one of my close friends noticed that I have swelling in my right side of the neck.
Oh, I'm so sorry for that. That must be frustrations.
Okay, all right.
Can you
It's
tell
not
me more about
frustrated.
that?
Can you, Dr. Faris, can be repeat what I tell you?
Yeah,
What I tell you, can just repeat it.
yeah. Have is family as can address the dresser
For what?
for swelling in the neck.
No. I tell you, I try address for my
Yeah.
wedding or my engagement. Okay, after 2 months. Okay, you understand what I tell. So what's supposed to tell the patient? Okay,
Yeah,
you
yes.
understand?
I hope to address it after that, after treatment.
Say again. No, just to tell the patient congratulations. Okay, thank you. Go on.
Yes.
All right. Okay, go on.
Okay, can you tell me more about that, please?
Yeah, I just noticed a small swelling. It is about 2 by 1 centimeter. It's like 20-cent coin in my lower part of my neck.
Yeah, on the right side or left side or what?
Right side.
Is start suddenly or gradually?
No, it is the sudden notice. I accidental notice when I try the dress. I found this is 20-cent coin. So it is 2 by 1 centimeter, round in shape in the lower part of my right side of the neck.
Oh, okay. It's that increasing or decreasing?
No, it is stationary because I just noticed. You
Okay.
need to ask the patient question to confirm it is a thyroid or not a thyroid. What is this question?
Yes. Any difficult on swallowing?
No. Before that, if this swelling is move up and down with swallowing, yes. So it is a thyroid swelling. Okay. After that, you ask about size. After that, you ask about something related to any swelling, like any swelling.
Yes.
It is any skin change is attached to the skin. No. After
Yeah.
that, what you need to ask apart from the swelling?
Ask
You ask
about
about pressure symptom, which is
it's difficult swallowing,
no difficult to swallow,
difficult of breathing,
no difficult to breathing, and any
change
change
of
in
voice.
no change on voice. Okay, so 3 pressure symptoms: dysphagia, dyspnea, and hoarseness voice. After that, you need to ask about thyrotoxicosis or toxic manifestations. You can ask.
Okay, do you notice any change in your weight?
No loss of weight.
Okay, any decrease or increase of your appetite?
No.
Okay, do you notice any change in your eye shape?
No change in eye or protrusion of the eye.
Oh, okay, Okay, about power of visions.
Is okay.
Do you have any prolonged constipations or diarrhea?
No any intestinal or bowel habit disturbance.
Yes. Do you not any intolerance for hot or cold?
No, I don't have any tolerance to hot weather.
Okay. Do you have not any change in your concentrations?
No, but it is important in some causes just a fine tremor and palpitation. So no fine tremor and no wearing of heartbeat. Okay, so I just revise with you. So you ask first about the swelling, like size, shape. So this swelling in the right side of the neck, lower side of the neck, move up and down with swallowing. So it is thyroid swelling, not attached to the skin. It is soft in consistency. After that, you ask about 3 pressure symptoms, which is dysphagia, dyspnea, hoarse voice. After that, you ask about toxic manifestation like nervous, irritable, fine tremor, increased heartbeat, what we call it palpitation, muscle pain, menstrual disturbance, intestinal or gastrointestinal or bowel disturbance, eye manifestation, heat intolerance, loss of weight, and sometimes you can ask for hypothyroid manifestation like what?
Against.
Like loss of hair, especially eyebrow. What else you need to ask? You ask about loss of weight. Okay, so what else you need to ask after that?
About any trauma for your neck.
Okay, but before trauma, if suppose this is a tumor, so what you need to ask about, apart from loss of weight? If suppose you have a
Yes,
cancer in thyroid, so what else you have?
do you
Lymph
not
node.
any
Any
nodes?
other swelling? So any swelling, you need any other swelling? Yes or no? So no other swelling. No other thyroid swelling, no other swelling. Okay, so you can start to ask about other system. Usually most of the other system you ask about. After that, what's your diagnosis now?
Okay, my diagnosis is hyperthyroidism.
Why hyperthyroidism? The patient have no irritability, nothing. It is just a simple goiter or goiter. Can you summarize first before we finish? Can you summarize?
Okay, the patient is Mary, is have right side swelling, is suddenly onset, also not increase or decrease. I have not have any hyperthyroid euthyroid status, not, and there is no compressive status symptoms.
Okay, all right. Okay, of course, it is. I forget just you need to ask about hypertension, diabetes, dyslipidemia in general. You need to ask about allergy, social history, family history, all this. Okay, so I just back to this patient. So after all this, uh, other system is okay, family history. If I say family history, I have a family history of goiter, and most of the family have goiter. What is the cause of that?
This may be medullary carcinoma.
No, doctor, don't be so clever. If the
Yes.
patient have no, and also don't be think for the tumor. First, if the common in family, it is goiter. Due to lack of iodine in some country in Gulf area, they don't have iodine. So if lack of iodine can have a goiter. But if it is a cancer, can be medullary thyroid carcinoma as a part of multiple endocrine neoplasm type 2. So this is direct to us to what is the name of the thyroid tumor?
Medullary carcinoma.
Follicular, papillary, anaplastic, and medullary. This patient is 22 years old. Suppose this patient have a cancer. So which cancer occur in young age, in 20? 20, very
Medullary.
young. No, medullary occur in old age, anaplastic old age, follicular at age of 30,
Papillary.
but papillary is young age. Okay,
Papillary, yeah.
at age of 20, papillary is multifocal, like lobular carcinoma of the breast. And this is a picture under microscope. We call it orphan Annie or empty nucleus, and this is microcalcification. We call this pneuma body. Okay? So back to the tumor. Which tumor, 1, 2, 3, 4, have a tumor marker? Which of these tumor have a tumor marker?
It's medullary.
Medullary. And what is the name of the tumor marker is?
Calcitonin.
Calcitonin. This medullary thyroid carcinoma, if the patient have medullary thyroid carcinoma, what other organ you need to test?
Yes.
To examine?
Yes. Adrenal.
Adrenal, looking for, so can be multiple endocrine neoplasm type 2. So medullary thyroid carcinoma have calcitonin as a tumor marker, can have tumor in the suprarenal medulla, which is called pheochromocytoma, and maybe parathyroid adenoma, can be neuroma, can be morphonoid picture. What is the tumor marker for pheochromocytoma? And you know, pheochromocytoma secrete catecholamine. So this catecholamine become met epinephrine in blood, and in urine become what?
Yes, phenyl
phenylmandelic acid, or VMA. Of course,
Yes.
multiple endocrine neoplasm type 1 is parathyroid adenoma, pancreatic adenoma, pituitary adenoma, so are benign. So the only multiple endocrine neoplasm or BEN2 or called Sibel syndrome have medullary thyroid carcinoma, pheochromocytoma, parathyroid adenoma. Okay, so suppose this patient have papillary thyroid carcinoma in the right side. Okay, so how to treat her?
Yes, after full examinations and routine investigations and stagings, I will work up with the multidisciplinary team for thyroidotomy, and if there is lymph node, I will
no lymph node, but which part you remove from the thyroid? This is right side. You make right hemicolectomy or total thyroidectomy. Right thyroidectomy or total thyroidectomy. In papillary in particular.
Right hemicolectomy.
No, it's actually in papillary it is multifocal. So it is wise or better in the papillary thyroid carcinoma to do what is called combination therapy. Suppose you remove by right hemithyroidectomy, which means that remove the right lobe and isthmus. So it is better to have another session and remove the left lobe, and after that send the patient for radioactive iodine. In some books recently, but we don't discuss this in exam, he say if the safety margin more than 2 centimeter, if the tumor less than 1 centimeter, so you can just do right or left hemithyroidectomy. Hemithyroidectomy means remove the right lobe or left lobe with the isthmus as a safety margin. Okay, so again, just to confirm, because thyroid tumor is very important, just to confirm that we have 4 thyroid tumor: follicular carcinoma, papillary carcinoma, anaplastic, and medullary. I don't consider lymphoma is a thyroid tumor because lymphoma occur after Hashimoto. It's not a proper thyroid tumor. The only have tumor marker is medullary thyroid carcinoma, which is calcitonin. The only occur in young age papillary thyroid carcinoma and characterized by the lymph node. So this is important in any neck swelling and any thyroid swelling to examine the neck lymph nodes. This is orphan Annie and pneuma bodies characteristics for papillary thyroid carcinoma. This is follicular, very rare, but can spread to the skull. And this is why when you examine the thyroid in exam or any neck exam, if the patient wear hijab or scarf, you must remove it because the follicular thyroid carcinoma can spread to a flat bone, special skull. Although it is rare, but can happen. Again, multiple endocrine neoplasm type 2 is medullary thyroid carcinoma, pheochromocytoma, parathyroid adenoma. Medullary have a tumor marker called calcitonin. Pheochromocytoma have phenylmandelic acid in urine. Of course, baseline investigation, thyroid function test, T3, T40, SH, neck ultrasound. If the cystic swelling, you can do fine needle aspirated cytology. The treatment usually surgery. If the patient toxic antithyroid drug, if the patient is cancer, we give radioactive iodine. Okay, Dr. Faris, if you see this picture, what is the wrong of this? Yes?
About surgery again?
About surgery for papillary or for other cancer. For other cancer, just write hemithyroidectomy. Like you remove the right lobe with isthmus. Except in papillary, it's better to remove the whole gland, what we call the total or near total surgery, because it is multifocal.
Okay, thank you.
Okay, Dr. Faris, if you see this picture, what is the wrong of this student or this candidate in exam?
Where is picture?
Okay, I don't share it or what?
Yeah.
I share it again. Okay, you see this
Yes,
now.
Yes.
Okay, so what is wrong?
Yes, in the left side.
Is that is the left
Doctor.
side, okay? But it is important to notice, if they say to the patient, I will take notes, you must take notes. Because some students say, okay, can I take notes? Yes, take notes, and he don't touch the paper. Okay?
Okay.
It is like if you
Thank you.
ask about pain. Yes, I have pain, so I will ask for medication. But this student also, he need to shave his burdens, so it is very important to shave. Okay?
Thank you.
All right, we have a last. I think someone is AS appear to be. He need to share AS. I don't know who's that because what is appear is abbreviation. Who's need to share? I think he is.
Okay, doctor.
Oh,
I am
okay. All right. What's your name?
Dr. Ahmed Sarhan.
Dr. Ahmed Sarhan. Okay, because it's just a mere abbreviation. This is very difficult station. It is about 50 years old woman referred from GP, has been diagnosed as chronic cholecystitis. She is in pre-operative assessment. Pre-operative assessment clinic is clinic common in England. You can have SHO or young doctor or sometimes anesthesia just to evaluate clerking the patient before admission. She had a history of intermittent episode of birthless for 10 years. Take a history from her. This is a station to take a history to assess the patient condition. We have many stations in exam for assessment. Sometimes the common physiology, including history examination and CSA investigation. Sometimes come as just a history taken at this station. So usually it is important in exam to know what is this station. If you don't understand what is this station, just ask the examiner. It is just a history taken. I need to examine the patient, something like that, to avoid misunderstanding. Okay?
Pre-operative assessment.
So it is pre-operative assessment and it is under history taken. It's not like in some we have post and the pre-operative assessment. You take a history, you examine the patient, you look into the investigation. In this is difficult, it's just history. And this patient have intermittent episode birthless for 10 years. So if you see this scenario, so the expectation at the end, I ask you, are you happy to admit this patient for surgery?
Okay.
Okay. All right. So we can start.
Hello, my name is Dr. Ahmed Sarhan, one of your surgical doctor.
Yes.
I was asked to for pre-operative assessment.
Okay.
Is it?
Yes, can.
Okay. Can I confirm your name and age, please?
I am Anne Mary. I'm 50 years old.
Okay, nice to meet you, Miss Mary. How can I help you today?
No, actually, I came today because I have gallbladder stone, and I admitted here to just remove the gallbladder.
Okay. Do you need any analgesic now? You have any pain?
No pain.
Okay, thank you. First, do you have any shortness of breath or?
No, you can ask in the proper way. Just you can ask in general. Okay. Yes, I have shorting breath. Yes. Okay.
Okay. Do you have any palpitation?
No. If you ask about shorting breath, you need to ask in detail.
Okay.
So
Okay.
for how long you have this shorting breath? For 10 years.
Okay. How often does this occur?
Yes, it is occur more frequent, especially in spring, and it stay about 10 to 20 minutes.
10 or 20 minutes. Did you take any medication for that?
Yes, the doctor described to me some inhaler, one of the white cap and the other is blue cap.
Okay. Did you take it regularly?
No, it is just in spring or if I go to gardening or inhaled any in something from the gardening or grace and
Okay.
all this.
Did you have a cough with that or
No cough.
no cough? Okay. Um, did you have any palpitation
No, no,
or
before that you need to, okay. So doctor, if you start looking for this patient have shortening of breath. So first, how long it take is about 10 minutes. It's okay once or whatever. I sleep well, all this. So can you describe the attack for me? Yes, I suddenly I feel that I have shortening of breath, unable to talk, tight chest. So I just put the inhaler in my bag and use it.
okay,
Okay. After that, you ask about chest pain, no chest pain.
okay. No chest pain?
No chest pain. No, I
Okay.
have chest pain. Make it yes, I have chest pain.
You have a chest
Sometimes
pain.
because from coughing, I have chest pain.
Can
So
you describe this pain? It is dully or colicky
no, it
or
is severe pain in the left side.
severe pain in your left side. Did it go
Yeah.
anywhere else?
What you mean anywhere else?
Like your shoulder, your back?
Left shoulder, no, it is not related to my left arm or shoulder.
Okay. Um, can you rate this pain, please, from 1 to 10? 1 is the least, 10
No,
is
it
the
is
maximum.
just three. It is just three.
Also 3, okay. It
Okay.
is limited to activity or not
No,
during.
it is just
Okay.
nothing.
Okay.
My doctor checks this and they make an investigation for me.
Okay.
Not
What?
okay, doctor. One of the evaluation in exam, we evaluate your intelligence. If I say I go to the doctor and doctor make me some investigation, so what is the next question?
What is the result?
What is the investigation first? He asked for chest X-ray, ECG, and echo.
I think patient don't know what is يعني, what's the blood test
No,
or something.
no, is your family is anyone don't know chest X-ray?
No. Okay.
Okay, all right. One of the cause of the bad performance in exams, students think that the patient is either layman or literal or ignorant man. Okay, so I go to my doctor and he asks for some blood test, chest X-ray, ECG, and echo.
Okay, thank you.
No, no, not
What is
thank you, doctor. Doctor, if you are not intelligent in exam, you will be in trouble. I tell you, the doctor asked me to do this. What is the next question?
what is the result of that?
All right, that's all are normal. Thank God. Okay,
Okay.
so
Good.
again, what we evaluated in this exam, we evaluate two items, maybe not evaluated in other exam. How to manage the time. So we give you task in short time, like cranial nerve examination in 6 minutes, which is difficult to do that. Second, we'll give you data. If you don't intelligent to tell the data, like for example, I have this for 5 years. So I go to the doctor. The doctor asks for investigation. So what's this investigation? What is the result of this investigation? You must ask like this. Okay, go on.
Okay. Do you have
So
any
or
abdominal?
abnormal. So no chest pain. All investigation is normal. Echo is normal. Everything is normal. Thank God. Okay. What else?
Do you have any abdominal pain in your tummy?
No abdominal pain.
No abdominal.
Except when I have this gallbladder problem, but now it has become chronic, so I have no pain.
Okay. Do you have any difficulty in urination or urgency or
Okay.
frequency?
So you need to start a systematic review from the headache and all this, or haphazard up to you. But
I will come
I
to it. Okay.
I don't have any difficulty in urination and the increased frequency and no change in color of urine. After that, what you need to ask?
Okay. Do you have any numbness or weakness in your leg?
No.
Okay. Do you have any change in your temperature of your
No.
leg hair?
No. No.
Okay. Do you have any headache last time, last
No headache.
days?
No headache.
You have do you have any confusion?
No confusion.
No confusion. Do you have any pain in your do you have any pain in your headache in your head? Have any swelling? Um,
Mhm. No swelling.
Do you have any unintentional weight loss?
No loss of weight.
Okay. Um, uh, did you memorize things or you have memory loss?
I think it's okay. I am okay. What else you
Okay.
need to ask?
Okay.
Okay.
Do
Why
you
you
have
ask this question, by the way? All right. So now,
like
what you expected this patient have?
okay, stress only stress because operation. I think.
Because you know that I think you make the decision before you start, and this is the easy way to fail.
Mm,
Okay.
I request them
All right.
so
So this is patient. If you come to the script, it is important to know. If you know the station before the exam, it is easy way to fail, because when we pick you, we change the script. So can you see here? This patient has a history of intermittent episode of birth for 10 years. So is this patient in stress for 10 years?
no
So not in
uh,
stress. So what is the condition can occur for 10 years?
can
If the
for
patient say, I have 10 years problem. So what is this problem?
10-year
Patient have
problem.
shortening of breath. If you see the scenario, because you are enter the station, put in your mind this patient have, what is your diagnosis again? Sorry, what is your diagnosis? What you say?
Stress due to the operation she will did.
Okay, good. All right. But it is logic to have stress for 10 years.
No.
But when I start to speak to you, I tell this patient have shortening of breath occur when? In which
Uh,
season?
spring bronchial asthma.
Spring. All right.
Okay.
Okay. All right. So it is bronchial asthma. Okay.
Okay.
Because it's not a stress in 10 years. You know that most of the student exam say it is a stress. But if you see here is intermittent episode of breathless. You can ask how long shortening breath. It take about 10 minutes, 20 minutes. Occur once per week, occur in spring, can be occur 1 month a year, others the year is okay. I sleeping well, no heart problems, so no nocturnal dyspnea or proximal nocturnal dyspnea. Of course, can be related to the gallbladder. Sometimes you need to describe the attack. You don't ask me to describe the attack. We have numbness. I have chest pain, but it is not ischemic heart because not related to the arm. I have biliary colic, so no problem, but it's now no. I don't have gastric pain, difficult to swallow. Other system is free, no fever. Of course, married. Any investigation done, I tell you the investigation and the result is normal, thank God. And other system, you ask about other system, medical history, family history, drug, social history. Don't ask me about smoking, which is important.
Yeah, well,
Okay. But
okay.
this is what happened on exam. So you enter the exam, put in your mind, yes, I remember this case of the stress due to saturation. So the first question, what is your opinion? This patient will be operated or you need to postpone the operation?
According to the anesthesia and GP, the old result she did is normal. I think I would send it to the anesthesia to okay to
No, doctor, this is not answer. You are responsible. Now, this is what we call the pre-operative assessment clinic. So it
okay.
is your decision. You just admit the patient or not admit the patient. You admit the patient for surgery tomorrow or postpone?
She tells that she has a shortness of breath. I think she could control it by the inhaler steroids.
But
And
he's
she can
now have no shortage of breath. They have a history of intermittent episode of breathless or shortage of breath for 10 years. He's now have no shortage of breath.
can do this.
Doctor, when we ask you an exam, we don't say sentence. You just say yes or no. So you
Yeah.
admit this patient for surgery tomorrow or not?
Yes, she can do
Yes,
it.
okay. So you admit it for laparoscopic cholecystectomy. Okay. So what is your diagnosis? What is this cause of shorting of breath?
Stress occurring due to the operation, bronchial
Doctor. If you don't pick the point, you will be in trouble in exam.
My main differential
This is patient in the script, in the main script. This is patient have shorting of breath for 10 years. Okay?
Okay.
It's not
But this diagnosis now she has a stress.
why stress? What
She
is
has
this condition, doctor? What is this condition for 10 years? What is the name of this condition?
she has a bronchial asthma.
All right, she has a bronchial asthma. This is have a fever, no fever. So it is not ischemic bronchitis. So
Okay.
is the anesthetist can deal with this condition?
Yes, of course.
All right, okay. By the way, for your interest of this patient have spasm during surgery, which is difficult to happen. How she can take the inhaler? What you say?
She couldn't take she couldn't take inhaler now or when in the operation.
No. Suppose she is inside the operation and have this bronchial spasm. What shall we do? The anesthetist, how he can give her inhaler?
Can do give her hydrocortisone. I think can
Doctor,
be.
he can give his medication or inhaler gases. You see nebulizer or all these machines, you can give this inhaler through the endotracheal tube. The trachea way is already baited. They already intubated. Okay?
Yes.
So if you need to have something bronchodilator or something you can give through the tube, the patient is already intubated. Okay? Doctor, what's your name again? Ahmed?
Dr. Ahmed.
If you have this attitude in exam, so the lay examiner said, although he have no fatal mistake, but he is not have this what we call it social intelligence. He don't pick a point, and this is bad attitude from the lay examiner point of view. Okay. So so now I just ask you. So this patient have bronchial asthma. And we have chest X-ray, we have everything done. What other investigation you can do for evaluation of the lung function?
Forced expiratory volume, chest X-ray.
Okay, all right. No. We start by first one. In your life, you ask to send the patient for forced expiratory. What is called forced expiratory what?
Volume one.
Volume. In your life, you send the patient to do that?
No, of course.
Okay, so if you this is -1 in professionalism.
Okay.
If you need to send the patient, you can send it for chest X-ray, for respiratory function test, for arterial blood gases. Okay, this is logic. Okay, a respiratory function test is like that. You can ask it in physiology. But what is this chest X-ray? What's your diagnosis? It's not this patient, but just for interest.
Oh, it is a black in the right side. It is pneumothorax.
What type of pneumothorax?
No shifting. It is only simple pneumothorax.
It's simple pneumothorax. It's not because the trachea is not shifting. It's just so it is spontaneous pneumothorax. Where you put the decompression needle?
In the fifth intercostal space in the mid-axillary chest tube.
So no, the needle.
Needle. It is only needle compression in the fifth intercostal space mid-axillary line.
Okay, so nowadays we put the decompression needle in the fifth intercostal space anterior to mid-axillary. If you read in all the books, they put in the second mid-clavicular, second intercostal space, but now we don't use this technique. Okay?
Okay.
So again, if you need to have an anxiety or are this adjust right, because many of the students say this patient most probably have an anxiety and the panic attack. And again, it is not the logic answer. All right. I just write it just to remember. Sometimes some patient, if have hyperventilation, he can have some sort of metabolic alkalosis and they can have something like a coma. Okay, so what I need to tell you, Dr. Ahmed, if you enter the station and put your mind, this station is stress due to anxiety because of operation. First, you give a bad impression that you know the station from the other candidate or from the other country, and you just tell us what your experience. It is very important. Sometimes I give the student X-ray, just pass to him. He said, okay, this is air under the frag. And actually, it is not air under the frag, but because air under the frag was the station yesterday. Today, we change the scenario. Okay? So it is important, again, when we have this exam, we don't evaluate your knowledge. We evaluate two things. First, how to manage time. So we give you task in short time. Second, what is your social intelligence? Like, for example, if we ask you, this patient have something and she went to the doctor and the doctor asked for investigation. So what investigation the doctor asked? Don't say because it is layman and he don't know. Anyone know I do X-ray, I do ECG. It is English word. Okay?
Okay.
And next question, what is the result of that? It is normal. So this patient is normal. Just a bronchial asthma. We can change the scenario. So you have a fever now, you have wheezy chest, so it is no need to operate it. We can postpone because have a fever, he have a cough, most probably have bronchial asthma. Okay. Last question. Sometimes the patient who take hypertension have dry cough. What is the cause of that? Which medication can cause that?
Hypertension and dry cough and ACI.
What is ACI? ACI mean?
Captopril, angiotensin converting enzyme inhibitor.
Angiotensin converting enzyme. So it is important to know that it is angiotensin AC inhibitor or brondopril or coversil can cause dry cough. Okay.
Yeah.
So again, as we mentioned, history taking is easy. Don't put your mind that in the situation that I know the station, this station like this, because these scenarios, if you remember, is repeated for more than 10 years now.
Okay.
The exam, next exam in Cairo is exam number 15, 50, and use the same questions. Okay?
Okay.
All right.
Did I
So,
summarize or
you can summarize. Okay, can.
yeah, in the exam, can I summarize for this all systems? Yeah, you have a bronchial asthma for like.
So just examine Miss Annie. Don't worry. This shorting breath is due to bronchial asthma. You don't have chest infection. The anesthesia and we can deal with this condition. Your investigation like chest X-ray, ECG, and the echo, if you have echo or respiratory, whatever they have, is within normal, so nothing will be afraid from it. Again, sometimes you present to the examiner, sometimes you present to the patient. If you present to the examiner, you say, Miss Annie is 65 or 45 years old, something like that. So it is important if you present to the examiner is different than you present to the patient. Don't tell the patient you are 50 years old because she knows that your age. You can summarize to the patient. Can summarize.
Okay. Summarize to the patient.
Yes.
You have a chronic cholecystitis. Don't worry. You are very normal. All investigation is normal. You can go to the operation and don't be afraid. You have only bronchial asthma for 10 years, but it is controlled.
Okay, and no complication and all this. Okay, so it is easy. So suppose you enter the exam, Dr. Ahmed, and you don't mention that bronchial asthma at all. What you expected that your performance?
0.
Okay, so what we found in exam, suppose you are usually, I examine not in Egypt, is overseas, but usually all over the world we have Egyptian candidates. So suppose you are 10 students after each other till that, so they give bad impression. Okay,
No.
all right. So now, thank you first. So it is important if you